Hello, it's Saturday, May 9th, and this is Dr. Nardone. Today's topic is on maternity in the COVID-19 era. I'm going to share some numbers with you today. In the early 1900s, maternal mortality was measured per 1,000 live births, and the numbers were 6 to 8 deaths of mothers for every 1,000 live births due to complications of pregnancy. Those are a lot of deaths. In fact, 30% of infants did not live beyond their first year of life. So pregnancy and childbirth were wrought with much risk. If you fast forward to today, we no longer measure maternal mortality per 1,000 live births. We measure it per 100,000 live births. And why is that? Well, with obstetrical improvements, with medical improvements, with management of infection and hemorrhage and good prenatal care, thankfully, we don't have those staggering numbers anymore. In 2018, in fact, 17.4 maternal deaths occurred per 100,000 live births. Now, any maternal death, of course, is a tragedy, but those numbers are a big improvement from the early 1900s. Now let's look at numbers related to COVID-19. As of today, there has been 1,327,000 or more cases of the virus reported in the US. There's been 78,834 deaths. Those numbers are staggering. What is the point of this? Why am I telling you this? Well, as mothers, and as this is the eve of Mother's Day, I think it's fair to say that maternal instinct is to protect our children and our children's children, and so on. And that maternal instinct is going to be the same for us today as it was in the 1900s. As Americans, we as a country will use our brain power, our ingenuity, and our determination to get this virus, this vicious virus, under control so that those staggering numbers are diminished, just as maternal mortality has diminished since the early 1900s. So on that note, happy Mother's Day to all, however your role is in some way, and keep your faith greater than your fears. Thank you and goodbye.